Where do women leaders go for real, unfiltered conversations regarding issues we don't often talk about openly? This is the place and the space. Welcome to Still I Rise, where we not only talk about it, we say the quiet part out loud. And remember to chime in on topics you'd like to have us discuss. Join us for Still I Rise. Thank you for joining us for another edition of Still I Rise. We have been having so much fun talking about things that nobody else talks about, saying the quiet part out loud. And we're going to have fun today because we've got one of the, she was a national president of the OBGY. What was the name of the organization? OBGYN of the world?
ACOOG, American College of Osteopathic Obstetricians and Gynecologists.
Okay, see, that's why I didn't remember it,
Right.
because it's a
It's
long.
about everything
It's
that
a
could
mouthful.
possibly go wrong with your
Yeah, it's
body.
about
She's
all of
president
this,
of it.
everything that's inside
All
of
of me.
all of this. So,
All the things, all the things.
and so thank you for watching and for tuning in. And don't forget to like, subscribe, share, make certain that you tell your friends, because this is where we really do talk about things that no one else is talking about out loud anyway. So joining us is the one and only Dr. Octavia Cannon. Woohoo!
Good
Woohoo!
morning.
I mean, she is, every time I've done any kind of presentation that would allow me to talk about health wealth, she's always been a part of it. Always, whether it's young people, whether it's older adults, whether it's television, she's been there and she has just laid it out in terms and words and everyday language that no one else can. So today we're going to talk about strong bodies and strong careers. And is there a correlation? If you want to get to the C-suite or the next level, do you have to have a strong body or can you get there without it? Or once you get there, how do you maintain it? How do you keep it? What do you need to know about the private parts? What do you need to know about checkups? What do you need to know about
There you
all of
go.
that? And there's no one better to talk about it than Dr. Cannon. Thank you for being with us today.
I am very happy to be here. Thank you for inviting me, and I hope you don't regret it.
We won't regret it, but you know what?
Never
Just
have.
full disclosure, why don't you give Sonia, Dr. Gunnings, why don't you tell them a little bit about our connection with Dr. Cannon?
Well, I'm proud to talk about our connection. First of all, Dr. Cannon and I are in the same sorority, the Alpha Kappa Alpha Sorority Incorporated. And the three of us together are all in the Links Incorporated. So we are Link sisters. We were in the same chapter together. And really, what happened was Dr. Cannon transferred from the Charlotte area. At the same time, I was moving to the Charlotte area. So we literally switched chapter affiliation. You all got the better deal than when they got me. But I've got to tell you that the women, the community here in the Charlotte area, to them, Dr. Octavia Cannon is nothing short of a legend. She's delivered everybody's damn baby, first of all.
Where's your curse jar?
I don't care. Wait a
Oh,
minute.
how many babies have you delivered?
I've been doing this about 30 years, so over 8,000 babies at this point.
Wow,
Well, I got to tell you, Paula, when we get a second, I don't want to take any away from the substance of Octavia, but she is among the most respected, knowledgeable, keeping it real people that I know. And I know that you know, Paula, you asked us to do the AARP session together, and you talked about keeping it real. And I've got a potty mouth. Dr. Cannon kept it real. I was clutching my pearls
Well,
like Jesus.
let's get her to
Let's
keep
get
it real
into it.
today.
Get into it.
Let's get her to keep it real. Talk about, if you will, the correlation, if there is one. And according to the Guardian, there is one, a correlation between strong bodies and the workplace. Something like 10% of women leave the workplace because of menopause, and we've talked about that. Something like 14% of women leave for other health-related reasons. And then 24% leave the workplace because of just the stress level of having to deal with caregivers at home, work, and all of the above. If you
That's
want to
all
be if
true.
you want to be in the C-suite, if you want to climb the corporate ladder, if you want to be an entrepreneur, what do you need to do to maintain a good, healthy body so you can have a good, healthy career?
The main thing that I would say is that self-care is not a luxury, it is a necessity. So initially, just thinking about taking care of yourself, and that is absolutely true in terms of the value that's lost in the workplace.
Mm,
Statistics have shown that over $2 billion of US dollars are lost annually because people miss work
mm,
because
mm,
of things that happen in with their health and with aging. But certainly this is something that needs to start even in college years, quite
mm,
honestly,
mm,
in terms of being mindful of yourself, of your health, and really taking time to listen to your body. I
mm,
think that the most important thing that one can do is if your body tells you that something might not be right, don't ignore it,
mm,
address it. Women in general are such busy people in terms of being caregivers for everyone else that their own self-care gets left by the
yeah.
wayside. And that is the problem. So certainly menopause can play a part in that, but even in the younger years, we see so many women in our office who are young and have issues with anxiety and depression. When they come for their annual exams, we do screenings. One is for depression, and now this year we've added one for, well, actually the end of last year, for generalized anxiety. And it is unbelievable how many people, even young women and a lot of pregnant women, have so much anxiety. And this certainly affects their everyday lives, not only what they're doing in the workplace, but how things go at home, how a pregnancy can go, how infertility can be affected by anxiety. So there are so many aspects to taking care of one's mental health. That's, a 3 day
How do
talk,
you how do
certainly.
you identify anxiety? How do you know if you are if you have anxiety? How do you know that? Because you just kind of go and you do and you move. How do you what are the symptoms of anxiety?
So, it's interesting that you asked that because before we started having the anxiety and the depression screening in the office, we only had the depression screen.
Mm,
And women were scoring high. But now that we have both, the depression screen is kind of low and the anxiety screen is very high.
mhm,
So really there are mental aspects where you might feel anxious all the time, or little things that often did not bother you in the past now bother you more. Like, oh, it's snowing outside. Here's a prime example. It's snowing outside. I've got to go to the store, but oh, these roads are bad. I just don't know if I can do it. Or, oh, I've got so many things to do today. I don't have enough time to do them. There's a little anxiety that most people have. It's a baseline. But there's also anxiety that is when it is paralyzing to you, where you
mhm,
don't want to get out of the bed because you're afraid of how the day is going to go, when you cannot sleep at night because you're
mhm,
worrying about things you can't turn
mhm,
your mind off. Many people say, oh, I have ADD, I have ADHD, attention deficit disorder, but it's not that. It is normal anxiety issues that you don't know how to address, nor do you know how to, I guess, manage them.
mhm.
Right, right.
Many people don't know when to ask for help. So I would say anything that you just don't feel quite right, even if it's this cold I can't get rid of. You would be surprised how many times that's related to depression, anxiety, and just overall lack of self-care.
Mhm.
Lack
Wow,
of self-care.
that's powerful. That's really powerful because
I'm
all can
actually
identify
glad,
women. We can all
right?
identify women that fit one of those categories.
Mhm.
I'm glad, Octavia, that you talked about sleep initially because I know that that is often an initial symptom that women will talk about. And with anxiety, or what triggers you to think that it might be anxiety, is when they say they have trouble falling asleep or staying asleep. And with depression, you'll hear women talking about they want to sleep excessively. So I was glad to hear you share, kind of watch your own behavior, watch your own patterns, and that sleep is really a good one to help give you some indication about what might be going on.
Indeed. And then going along with that is that's the time where you're kind of trying to settle down and you might notice your heart's racing. Heart
Yes.
palpitations can be
Yes.
anxiety, but they can also be a sign of menopause.
Yeah.
So there are so many symptoms that seem basic, but they all intertwine. So my advice would be anything that just kind of seems off, or if someone who is around you or knows you mentions, "Are you okay? How you doing? You
Yeah.
feeling okay?"
Uh,
Yeah.
Then you know that something might be going on. And I would invite you to do that for people that you care for. How you feeling? You doing okay? Just do it. I always send a
Mhm.
text to somebody and say, "Hey, it's a wellness check. How you doing today? What's going on?" Particularly if I know if they're going through something. I'm still someone who writes cards and sends cards too.
Mhm.
So, just dropping something in the mail when you get a minute, which is easier said than done, I know. But certainly, part of self-care is caring for others, but you cannot get lost in that caring
so
for
what's the
others.
first thing you should do? So let's say I have all those symptoms. It's kind of hard for people, particularly if you are a woman in the workplace and you've got a lot of responsibility to own up, to say,
Mhm.
okay, I've got to
Mhm.
stop, I've got to pause here, in order to take a step backwards in order to go forward, actually. So
Mhm.
what should they do? I mean, who do they talk to? They immediately go to the doctor, or what are some tips for the person who's
Well,
going
I'm
through?
going to tell you right now that most people say when they come in, "Well, I went to see my primary care, but they weren't listening to me. I didn't feel
Yes.
Mhm.
heard. I didn't feel
Mhm.
seen." And that's why I'm always 15 minutes behind at least in the office because I'm letting people be seen and heard.
Yeah, just no,
Um,
and you can talk about your office. Your office is, tell them where you work.
I'm a physician at Alliance Obstetrics and Gynecology in East Lansing, Michigan.
All right. So just in case anybody wants to get those parts checked out or talk about their mental health or their depression or anxiety, this is a safe space to do that.
Yep, I'm here for your bits, girls. Here for your bits.
All
That's
right.
what I do. So, I think that people do just want a safe space where they can be heard. But I will also say that many times it's not just going to the doctor, it's talking to your friends. Like I said, or even honestly, even coworkers that say, "You seem a little bit off. What's going on with you?"
Mhm.
That type of thing. Although sometimes you have to take that with a grain of salt, it's also important to listen to that. So, starting with listening to yourself, and if you don't want to listen to yourself because you got too much to do, you don't have time to think about it. If people are dropping hints, take the hint. It's
Mhm.
almost like when somebody says, "You want a breath mint? You want a mint?
Yeah.
Take a
Always
mint.
take it. You
Take
told
it,
me that
honey.
before.
Take
When
it."
they offer you one, always
Yes.
take it because they may be
Yeah.
trying to tell you something, right?
That's right. That's right. You don't know, but err on the side of caution. I always tell my residents in the hospital, if you stay ready, you ain't got to get ready.
Right. And not only,
So,
breath mints in terms of refreshing your mouth, but you talk about all refreshing all parts of your body as well. So
indeed, indeed.
So it's
Or
not
get me in trouble.
appropriate to be in a conversation and go, "My God,"
Yeah, right, right. Well, I have
Give them a little
techniques
bit.
that I've fostered over the years. I'm very good at holding my breath. I feel like Shelley Winters in the Poseidon Adventure. I'm aging myself, but yes, I can do that. And sometimes it's necessary. But I think that's where you start. Start with your physician, your primary care. If you can't get what you need there, then move on to the next. I think, the thing that people need to realize is just because this person or this office has been your medical establishment for years, if it's not working for you anymore, you must change.
Yeah. Yeah.
You have to find your person, for lack of a better term, to try to help you feel seen, feel heard, and feel comfortable to weep in my office, or
Mhm.
just feel like you have time to say all the things that are bothering you. Because,
Mhm.
like I said, there are so many issues. I think that's one of the things I see with women who are in perimenopause, which is not quite menopause, but you're having symptoms, and that can start as early as 35. So you see what I mean about, knowing these things early on, but also women who are menopausal and just feel like they're dying. I've had patients say, "So I'm not dying?" No, you're not. But you need someone to validate your concerns. So,
Mhm.
and this goes for anything that's going on with you. If your private provider is not validating your concerns, it's time to find someone new. But start there. Sometimes it starts within, but you might have to take a listen to other people and then move on to your primary care or your OBGYN.
and
I
some
think
of it,
the
and
oh
thank you for that. But some bodies do change with age. I
Yes.
mean, there are
Mhm.
some things. I mean, in terms of just a level of energy, the level of mental alertness, all of that, they do change. So, talk a little bit about some of the changes and how we can still stay vibrant and full of vigor, and what we can do to keep, particularly women. I mean, your caregivers, your house husbands, your wives, your you have children, whatever. there's a lot going on, and sometimes you just don't pause. You don't pause to do that. So talk about how our bodies change and what we can do to keep them strong and healthy.
So the thing that to remember is, our brains are affected by the loss of estrogen. So once your estrogen starts going down, it can affect you. That's what we call brain fog, where did I put my keys? Or where are my
Mhm.
glasses? And they up here on your head. Right, there's that. Sonia Gunnies. All right, there you go.
Everyone knows I've got so many, I can't find my glasses and they're hanging on my face stories.
Yes.
It's ridiculous.
Yes, I enjoy those. Those are funny to me, but you're not alone. It happens all the time. But the thing about is, our bodies are equipped to help us thrive, but sometimes things go by the wayside. So when someone becomes menopausal, that estrogen goes down, the progesterone goes down, and it can affect your brain just like other parts of your body. So if you think about the things that are affected, we talked about, dryness, dry hands, dry skin, dry eyes, dry mouth, dry vaginas. If I may be frank, those things are all affected by
And
that.
that could be a problem now. I know this dry skin and all that is that could be a real
Yes, because it can
problem.
be painful. It could be itchy. It could be painful. Even when you're having intimacy with your partner, that pain from vaginal dryness can be excruciating to the point where even if you do use lubricant, if it's a water-based lubricant, it will burn like fire. It
And,
gives new meaning to Alicia Keys. This girl is on fire.
and I want to just interject. I don't want to interrupt you, but there's continuing to have sex also helps with your mental and with your energy level and just gives you a new kind of, I forget what they call it, but it releases an energy inside of you as well. So
Yes,
not just for
Lord.
Endorphins.
the
Yes,
pleasure. Yeah,
Lord. I'm here.
yes,
Yes.
yes. So
Yes.
Endorphins. So
endorphins, that's what yes.
it's
See,
just
that's
like
that
what
brain
you're
fog.
saying. Yeah,
Mhm.
so just like you said, that's very true. So we want to continue to do all the things that make us feel whole.
Mhm.
So, that's another thing you could talk to your physician about in terms of what can I do for vaginal dryness? And there are so many things you can do, including using olive oil or coconut oil right out of the kitchen for sexual lubricant and moisturizer. Literally works the same, putting some on your partner and some at the opening to begin with. So there are things that you can do to help. But going
I
back
put it
to
on
even
my
the
face and
mental,
never thought about other body
Right.
parts,
yes,
or
yeah,
hair and
everywhere.
skin. Yeah,
Yes, absolutely.
You
yeah.
know, the first time I heard Octavia talk about using olive oil, I got to tell you, I was in, my husband and I were in the grocery store. I had never purchased olive oil
Oh,
before. I usually don't even cook with it. And
Ah.
so I grabbed a bottle. He noticed that. He was like, you're going to try to be healthy with the oil. And I just said,
Yeah, but it's health. It is
You don't
health.
need to know every damn thing.
It's health. You're right, right, right.
So that's
I'm trying to
real.
help you out,
All
sir.
right. Well, I'm trying
Trying
to
to
handle
help you
some
out.
business here.
Right, right,
Let
right.
me
But yeah,
ask you something, Octavia, because I don't want to lose you because I think there is something you said that I think is worth um, women that we are addressing hearing a little bit more about. And you started off by saying self-care. And as Paula and I have often said on this podcast, making yourself a priority in your own life.
mhm.
So if we were to say to women, if you do nothing else to make that happen, what are some of the things we would tell them that they need to be engaged in doing or make a repetitive sort of pattern or activity or whatever if we are really focused on making ourselves a priority? What are
Yes.
some things
So
women need to do?
several things. The first one is listen to your body.
Good.
But things that you can put into your phone and your calendar to make happen are annual visits with your
I like
primary
that.
care
I like that.
physician. Um, See your OBGYN, although some primary care docs will do some of the basic gynecology stuff, and that's fine too, honestly. If you just need a pap smear, then
Mhm.
that some if you feel comfortable with your primary care, then that is no worry at all. And if it's something that's beyond their scope, they're going to refer you to OBGYN, particularly
Mhm.
once you've had your kids. You don't
Mhm.
necessarily have to come see us all the time. But when things get a little more involved, they're going to send you back to us anyway.
Mhm.
So that I think that's important. So your annual physician visits, your annual gynecology visits, your first colonoscopy at
Mm.
age 45. And when they offer you the propofol, go on and take the propofol because you will sleep for that 20 minutes and feel
It's the
like you
best
slept for two
drug on
hours.
earth. It's the only drug I've ever, but yeah, can I have a colonoscopy tonight?
So propofol, that's just something, and it really helps if you are someone who's anxious.
Yeah.
This is a good
And there's
option
no
for you.
after effect. I mean, you're not drowsy or
Yes.
lackadaisical the next day. That's what I like. Yeah.
Yeah.
Mhm.
And people
Only
say,
once
oh,
every
that's the
10
Michael
years,
Jackson
but yeah.
drug.
What's
That
that?
Michael Jackson kind of gave that propofol a bad name, but it
Oh,
is when used appropriately with the correct physicians and providers, it is very safe and it
Mm.
is very helpful. It will change your mind. I think people are apprehensive about things like colonoscopy for that reason.
I
Yeah.
only
But
get it every 7 or 10 years, whatever they tell me. But
that is
it's good.
correct.
I look forward to it every 10 years.
And the American Cancer Society now recommends you get it done at 45 instead of 50,
Mm.
particularly because many younger people are getting colon cancer and dying of colon cancer, people
Mm.
in their 40s. So if there's a family history of colon cancer, or if you were approaching 45, I strongly recommend you do that. So put that on your list.
Okay.
Mammograms annually starting at
Really?
age 40.
Mhm.
Annually?
Start, sorry?
Annually?
Yeah.
Yes,
Yeah.
mammograms starting at age
Yeah.
40.
Right.
Starting at
So
age 40.
until you forever?
75 is the
Okay.
national recommendation.
Mm. Mm.
75.
Check your
Um,
boobs, Paula. Check your boobs.
yep, go and check them out now.
Check
And
them
but
out.
I gotta find them first.
I got you, baby. I got
All
you,
take the
right.
baby.
time to find them.
Yes.
They
This is
be
that
squeezing
brings
and
that
trying. They put you on
yes.
that machine and it's like a
Yeah, yeah.
jackhammer.
It is uncomfortable, but it is necessary.
Yeah.
I will say that a lot of women find breast cancer masses, lumps themselves on their breast exam, which you should be doing once monthly.
Mm.
If you are no longer having menstrual cycles, usually it's the week after your menstrual cycle. But if you're no longer having
Mm.
cycles, pick a week out of the month and do it that week
Mm.
because you still need to know what your normal is. So
Mm.
you should be looking at your entire body in the mirror. Get a mirror and look down below. You're in the bathroom, look in the mirror, look at all your parts.
Mm.
Because if you don't know what your normal is, you won't know what abnormal is.
Oh,
There are
Mm.
other
okay.
things people always think about, oh, sexually transmitted infections, but there are other things that can affect women as they age, like diseases, like a skin disease called lichen sclerosis that can be on the vulva, on your vaginal area, and it causes severe itching, redness, pain. And people don't think about it because why would you think anything's going to happen down there?
Mhm. Or you're ashamed
So,
to say that's going on.
indeed.
Tell your
And
primary care
I was
provider.
surprised about a year or so ago to learn that some of the age group that's getting sexual transmitted diseases the fastest are older adults. The most are older
Yes.
adults.
Well, honey,
Yeah.
those senior
With
living res, well, the senior
Honey,
living, they living.
with or
when
without olive
Octavia
oil.
told me that, I about passed out. We were
Yeah.
talking about places that we would want to retire and live. And I had mentioned that we were looking at a 55 plus community. And she said, well, you can look at it, but you need to be aware that there is an escalated incidence of sexually transmitted diseases. I said, among old people like that? I mean, it never
Yes.
even occurred to me.
Older, not old, older.
No, I'm calling it like it is.
Older
Old
people.
people.
Older
That,
people.
and
Yes.
Old
it's
people.
gonorrhea, HIV,
Jeez,
hepatitis
I
B and
never
C,
would have thought that would be so prevalent in that age group.
and
Yeah.
trichomonas, believe it or not. Here's the
Wait,
reason.
what is it? Trichomonas?
Trichomonas is another sexually transmitted infection. And the reason is because the dry vagina, it's having like a bunch of little mini cracks in your
Ah,
vaginal tissue. So you're more susceptible to getting things that you would normally fight off. So that includes yeast infections and bacterial infections. So what people don't may not realize is that a yeast infection in a woman is exactly the same thing as jock itch in a man.
Hmm.
So
oh,
if your man has jock itch
I
or
see.
he's scratching, or you see when you go in the his bathroom and you're dating, you see tenactin, red flag
Hmm.
because he may have some issues with yeast. So it's and you can get yeast even if you're doing all the right things. If you have diabetes, then you may be more susceptible to getting yeast infections just because you have the suppression of your immune system. So again, circling back to going to your primary care is important to get screened for all of these things. If you go once a year, they're going to screen you for thyroid issues, diabetes. They'll
Mhm.
screen you for high cholesterol, heart issues, all of these things that can present as anxiety symptoms or menopausal symptoms.
You
So I
should know
find
your
myself,
numbers. I mean, people need to know their numbers, right? To
Yeah,
yes.
yeah,
change.
Yes, and even
yeah,
and generally when you go to the physician, they'll give you a printout of your numbers. And
yeah.
sometimes when you check out, they say, "Would you like a printout of your visit today?" And if you're not someone who is comfortable looking on your phone to look at it through an app, then just say yes, so then you can keep track of it. So that's very important. But there are a couple of other things that we need to discuss in terms of things you need to do regularly. One that's often forgotten, but is very important, is the dentist.
Mhm.
You should
Yes.
have go if you need to go for a cleaning or a hygiene appointment at least, well, twice a year. But even if you only go once a year, it's very important. Another side effect of menopause is loose teeth and osteoporosis. And so,
Mm.
my joke is that I don't want a man with summer teeth. Some are here, some are there, some are
These are
there.
real. Are yours real, Sonia? Are
Yeah,
yours?
mine are real. My
Mine
teeth are
too.
real.
They don't come
Yes,
out.
Yep,
Not,
yep,
yes,
not
yes.
yet.
But they can
They
if you
yep,
don't
can.
watch it. Now I'm just trying to
yep,
tell you. So, and it
yep.
really comes from osteoporosis. So bone density
Wow.
scans every 2 years, starting at age 50. That's
Mm.
another thing that sometimes your primary care can order it, but your OBGYN, I often order them for patients because you don't think about it. It sounds scary, but a bone density scan, you literally just lie on the table and it just goes over your body. It's like a scan that goes above you, over your body, like a little
Mhm.
x-ray. And especially if you remember seeing your grandma, your aunties, or your mom with walking kind of hunched over, that's a
Mm.
Yeah.
sign of osteoporosis. So, those things should be warning
Mm.
signs
Mm.
in terms of things you need to check for, particularly if you're not doing any hormone replacement therapy. But even if you are, those are things you need to think of. So, the other thing I will say quickly, I know time is short, but weight-bearing exercises, getting those little weights and putting on your ankles and go for a walk, or
Mm.
even the little hand weights, 5 to 10 pounds, and just when you're walking, move your arms back and forth as you're walking. That will also increase your heart rate and assist with heart health. So there are so many things that you don't think about, but I'm telling you that I really can't stress enough the loose teeth, because that is
Wow.
devastating. It really, and then you're often prone for infections in your, teeth, tooth abscesses in your gums. And then if you get people, my grandma and them would call it blood poisoning, but it's called sepsis, and that's an
Yeah.
infection in your blood. But
Mhm.
you could get sepsis from a cavity or an abscess in your gum that you never
Mm.
got addressed because you didn't make time to go to the dentist.
And then that can
So
affect your heart as well. That can affect your heart as
absolutely,
well. Yeah.
absolutely.
Yeah.
It could kill you.
Yeah.
Yeah.
Wow. Wow.
Yeah.
Yes.
I hope that y'all took notes, and I hope that you
Yes.
will, yeah, record this, share this, not just because we want you to subscribe, like, or share, but because it's such
Mm.
good information. Just very quickly, we've got like about a minute or two left. Diet. Talk a little bit about foods that I know people always talk about foods, but are there any things that we should stay away from? That might be a shorter list than all the things that we should eat as
So
we.
this is a sticky one because honestly, it's hard to break old habits, right? If you were raised in a household that ate lots of high carbohydrate or high sugar foods, rice with dinner every night, potatoes, breads, the best rule of thumb is to even just kind of look up a paleo diet, a PALEO diet, which kind of focuses on, it's based on, the Neanderthal man, the caveman back in the day, and how it's really more about lean meats and fish and vegetables, nuts, fruits. So those types of things. Everything is good in moderation in most cases, but
Like
you
cod
got to get.
liver oil or a vitamin D, are those really things that we should be thinking about taking or
So the cod liver oil is going to help your bowels, but be careful. Yes, yes, watch yourself now. But yes, the vitamin D and calcium, particularly for bone health,
yes,
yes.
yeah.
And if you are in, I was going to say if you're in a colder climate in the winter, but really anywhere, if you want to try to increase your health during the winter season, no matter where you live, vitamin D, zinc, and vitamin C, that's a nice
Mhm.
combination to keep on hand. And I know many times you can buy over the counter vitamin C and zinc together in one tablet.
Yes, yeah.
So that's important as well. And even a daily vitamin is good. But make
Vitamins
sure
are
you're
good.
getting your grains
Mhm.
and putting a little moderation on the things that often taste great but aren't so great for you.
Mm.
I just hope you never, wherever you go, we're gonna stay connected. I know that. I just hope you never
Absolutely.
leave this profession. You are just such a gift to so many
She
people in
is
so
so
many different
phenomenal.
So
ways.
kind.
It's so phenomenal.
Yes.
Absolutely. So I'm glad
And
that
she
Charlotte,
gave us one tip, Paula, that I think if you want to start somewhere, ladies, we aren't good about thinking about ourselves. And so I heard Dr. Cannon say, schedule yourself. Go to your
mhm,
phone, go to your calendar, put
right.
yourself in your own scheduled life.
That's
And that
something.
starts
Make
there.
yourself a priority.
Make
Strong
yourself a
body,
priority.
Yeah. Yeah,
strong
and
body,
don't be
strong.
frustrated if you can't get in within the week that you call, because that's not going to happen.
Mhm.
Put it in 3 months before you want to actually have the appointment so you can have it in place. Because
Mhm.
people will often use that as an excuse. Well, they couldn't get me in this week. Ma'am, you just
Yeah.
called yesterday.
Yeah.
You called
Strong
yesterday,
body,
ma'am.
strong career,
Right,
That's it.
right,
and
right.
healthy life too. We
Indeed.
appreciate you. Please like, share, subscribe. Woohoo! Look at that muscle. I was looking for my weight. Oh, here it is. See?
I've been working on my flabby arm.
Very
There we go.
good.
See, you
Very
Very
sitting there
good.
good.
watching meetings. I was looking for it earlier. Yeah, just
Wait,
sit there.
Yes.
Yeah.
that looks like
Hey,
a weapon in
I
your
listen to
hand.
my girlfriend. That's it. She knows what she's
Yes.
talking about. I
Yes.
appreciate you. Please like, share, and subscribe. Let us know what you think. Put in the chat, put in comments that you might want us to talk about, topics that you might want us to talk about. But primarily,
Communication is the key. Talk to your
Mhm.
doctor. Make a list before you go.
absolutely. And number one, take care of yourself.
Indeed.
Put yourself a priority. Thank you.
Indeed.
Strong body, strong minds. Thank you.
Bye.
Bye.